Nearly 1 million people infected globally. We take a look at the escalating human and economic costs of the coronavirus pandemic. Hello, I'm Anand Naidu, and this is The Heat. Health experts say prepare for the worst as the coronavirus pandemic spreads around the world. And a grim prognosis for the United States: more than 200,000 Americans could die from the outbreak. While the human cost is staggering, the economic price is also high, sending global financial markets into a tailspin and nations spiraling towards a recession. We begin our coverage with CGTN's Nathan King, who's live at the White House. Nathan, we've come to expect the daily news conference from President Trump and other officials in the task team at the White House. Today's was a little bit different. It started off with the war against drugs and then segued to the war against the coronavirus.
Yeah, and reporters weren't told about this in advance. They trooped and essentially sat there while the top brass of the military, including the Defense Secretary and the National Security Advisor, came out. And it was about drugs, but essentially also there was a hidden message there, both visually and explicitly. The National Security Advisor, Robert O'Brien, said it. Do not take advantage of us. This is a message to adversaries around the world while we are dealing with this health crisis. That was very explicit. So that was extremely interesting to see. And the fact that reporters weren't told about it in advance suggests perhaps that they wanted to do that for maximum effect at the top. But then the military brass left, and then the healthcare experts came in, Dr. Anthony Fauci and Dr. Deborah Birx, who we are used to, as well as the president. And nothing really can sort of take away from the previous briefing, which of course was that really shocking moment, which we all knew was coming, but just to see the graphs up there of predicting between 100,000 and 240,000 deaths in the US, even if mitigation and stay-at-home practices are followed. And this basically followed up today on that. And as you know, it's had an effect already around the country. Florida, for example, one state that has resisted stay-at-home orders, 21 million people. And you know, there's a lot of elderly people in Florida. And just a few days ago, you saw people packing the beaches there. Well, they now have a stay-at-home order. Mississippi, Georgia, Nevada, just some of the other states that are also announcing. So essentially, we have 300 million Americans nearly ordered to lock down. There's still about 10 states or more that still haven't done this. And the US president is saying, look, I don't want to tell every state to do it because some don't have many cases. But as you know, a few cases can lead you to where New York is right now.
You know, Nathan, something else that we don't see very often. I mean, we're all aware that the United States is the wealthiest country in the world, well, wealthiest financially, that is, in terms of money. And we often see aid from the United States going to other places around the world, other countries which are in distress. But now we are seeing aid come to the United States, some from some very unlikely sources in many instances.
Well, yeah, you're right. And in fact, the US was sending aid out to other countries, including China, by the way, at the beginning of the virus. But it has seemingly slowed that down as the demand here becomes huge. Now, one thing that we haven't seen that many headlines about, and it's sort of been negotiated behind the scenes by the Donald Trump's son-in-law, Jared Kushner, is this Operation Airbridge, which is bringing in much-needed supplies much faster by air, largely from China, although they're saying Asia. Let's take a listen.
FEMA and HHS formed a historic partnership with the private sector called Project Airbridge to bring supplies from other countries to the United States, including gloves, gowns, goggles, and masks. These supplies will soon be distributed around the country. We have large cargo planes coming in from various parts of the world. Every day, new plane loads are landing in cities such as New York, Miami, Chicago, Los Angeles. Additional flights have been scheduled, and we're adding more and more.
Well, let's hope it works, because there are more and more reports of that federal stockpile of ventilators and other equipment essentially running out. down to their last bit, is what officials have been saying to the media in the last few hours. And more states are needing more and more stuff. Some, not just New York, Alabama, for example, says they're going to run out of stuff this weekend. So the supplies are more and more necessary. And one final point on aid, by the way, the US president was asked about China sending aid around the world. And he was, you know, there has been some competition, let's put it that way, in some eyes. But the US president said, look, if China's got excess, that's great. We are all fighting this virus, which is now, he said, in 151 countries.
Thanks, Nathan. That's CGTN White House correspondent Nathan King for us there at the White House. Well, for more, I want to bring in our panel right now. Kate Tulenko is the founder and CEO of Corvus Health. She joins us here in Washington via Skype. Joining us from Beijing, Einar Tangen is an economic and political affairs commentator. From New York via Skype, Anthony Chan was a former chief economist for JPMorgan Chase & Company. And Joseph Williams is senior news editor for U.S. News and World Report, also joining us from here in Washington. Welcome to all of you to the show. Kate, let me start with you. The United Nations is now calling this pandemic the worst crisis since World War II. This is what UN Secretary General Antonio Guterres had to say. Let's listen.
This is indeed the most challenging crisis we have faced since the Second World War, and the one that needs a stronger and more effective response that is only possible in solidarity if everybody comes together and if we forget political games and understand that it is humankind that is at stake.
So, Kate, what do you make of the current efforts to fight the pandemic, not just here in the United States, but around the world as well?
Well, I think he has a point at this being worse than a war in many ways. When you look at World War II, we had two theaters of war. We had Europe and in Asia, but now all parts of the world are involved in this. And the responses have been a different set of responses. Many countries have tried to do the crackdowns of having people stay at home. Some, such as South Korea, have been very successful with the testing. And I think we're going to see a new wave of attempts with some of the low and middle income countries trying to see if they can keep their economy open but do social distancing and keep the regular health system open. We know that from the Ebola outbreak in West Africa, more people died from lack of access to health care than actually died of Ebola. And also in looking at many countries and many poor countries, we know that 9 million people a year die of malnutrition and starvation. And so in countries with large numbers of poor and people who live day to day, this might aggravate that problem. We might see more people dying of starvation and malnutrition.
Something else, Kate, and that is the virus spreading to the developing world. We've not seen very high infection rates in the developing world. And some of the experts think the reason for that is because many of the countries have not yet carried out extensive testing. So could it be a lot worse than we know right now?
I think a lot of it probably is due to lack of testing. Some of it might be due to a different type of virus. I've seen a speculation about that in India, but I haven't seen a lot of proof around that. There's also the speculation that since warmer, wetter air will weigh the virus particles down, that you won't see as much transmission. Also with more ultraviolet light, more sunlight, the virus will die more quickly outside. But as testing has been ramped up in countries like South Africa, we're seeing more and more cases.
All right, Joseph Williams, I want to ask you about the news conference that took place at the White House just a few hours ago, where it started out with, as I pointed out, the war on drugs. The president was standing there, flanked by a lot of military brass around him, including and also had the defense secretary with him as well. And they talked at length about the war on drugs and how they didn't want cartels to be taking advantage of the United States at this time. And then later on, he brought the experts in on the pandemic, and they started talking about that. What did you make of it?
It's hard to fathom how in this moment a demonstration like that makes sense, other than to think about the fact that it's been some 2 months, give or take, since the president has had a campaign rally and we are in the middle of a 2020 election. That's the only sense that I can make of it, is that the president can no longer have his rallies and can no longer tout all these successes that he says he's having. In the press briefing today, it's a captive audience. They are here and they were not told about this in advance. So basically the maximum effect, as your correspondent said, was to have them cover something live. The TV cameras were there live and they were broadcasting live that he can't get across any other way, because COVID is the only story that's happening around the world, not just Washington.
Yeah, that does make sense. This could be a campaign opportunity. Joseph, I want to get on to the COVID-19 virus itself. Yesterday, Nathan King referred to these figures. Yesterday, Dr. Anthony Fauci, the director of the NIH, as well as Dr. Deborah Birx, who is coordinating the White House response, were talking about a casualty rate of something like between 100,000 and 240,000 before this is done. These are, of course, projections. So we're actually talking here about something this getting really a lot worse in the future, isn't it?
Well, yes, and the potential for it to get exponentially worse, we're seeing it play out in real time. And the numbers sound kind of abstract. I mean, you think about 200,000 people set against early projections, which were close to 1 million, but still 200,000 people, it's the size of a small American city. It's the size of Baton Rouge or Birmingham, Alabama, disappearing overnight. And these aren't just all people who had underlying health conditions or who might have been older. These are some young people. These are doctors. These are attorneys. These are healthcare workers. One of the scariest things to think about in this pandemic, besides the fact that a lot of these healthcare workers don't have proper protective equipment, is the fact that many of them will get sick and die on the job. They will get sick and die protecting people from getting sick and dying. And if that happens, it happened in China, it happened in Italy, it's happening in the United States. When that happens, there is a point where it might reach critical mass, and then all bets are off because you no longer have caretakers to look after people who are sick and coming to get relief from this disease.
That doesn't sound good at all. Let me bring in Einar Tangen. He's in Beijing. And Einar, what's the latest from China?
Well, China is, quite frankly, amazed at what's going on. I mean, it's defending itself from trying to help the U.S., trying to send aid, and yet they're being constantly rebuffed. I think they're going to take the high line on this and just let history judge whether or not there are any kind of issues. But, quite frankly, unless a drug dealer is considered an essential services, I don't think that this is the time to be worried about that. It's not like 300 million people on lockdown are going to be having a direct line to whatever kind of substance they're addicted to. So this is purely political, and I think that's the message that China is getting. There's seems to be a kind of passive, aggressive stance on this, where at one point, without willing to say it, the U.S. is willing to accept aid from China, but on the other, you have Tom Cotton and many others vilifying China as if this tragedy is somehow connected to their economic and political goals.
All right, Anthony Chen, today, of course, is the first of the month. This is when many people have to pay rent. They have to pay their utility bills. There is help coming from the government. Of course, they'll get that help in a few weeks when those stimulus checks arrive in their mailboxes, but that's a one-off payment. So do we see lots of payments coming in the future? Is Congress going to have to pass a lot more bills?
Well, I think that everybody knows that the relief bill, or stimulus, if you want to call it, was in fact geared so that it would provide enough funds for approximately 2 to 3 months. If this pandemic persists beyond that, then of course they will go back. In fact, you already are hearing some noise in the administration that they're talking about bringing back the extra expenditures for infrastructure that could total easily over $2 trillion. We know that they also have the Paycheck Protection Act, so that it encourages companies to keep their workers in place. And of course, even those that are not able to stay in place, namely the service sector, they will get enhanced unemployment benefits. So all this in an attempt to try to offset it. Will it be enough? Absolutely not. But it certainly does try to cushion the blow of this terrible economic disaster. But of course, when we talk about an economic disaster, it's an even greater health disaster, and that's what we should be focusing on.
Right. And Anthony, there Could the administration come under increasing pressure to impose something like a rent freeze and a mortgage freeze and a freeze on other kinds of payments? I mean, can the government do that?
Well, the government already is doing that. Right now, the CARES Act really provides an opportunity for people that have federally backed mortgages to basically get a moratorium of up to a year. If you look at things like Fannie Mae and Freddie Mac, if 50% of those individuals claim some sort of a hardship because of the COVID-19 virus, over a 6-month period, that will mean that the government actually has to make up that money. And the numbers add up real quickly to about $200 billion if half of those individuals claim that they have some sort of a hardship. And I say only half because remember that in the United States, there are some jobs that are basically now moving to the house and people are getting paid. A lot of companies are taking the oath and the pledge that they will continue to pay their workers. So yes, a lot of people will lose jobs. We saw that last week. We saw 3.3 million people filing unemployment insurance. I think it wouldn't be a shock if tomorrow morning we see the same or a greater number of people. By the time this is all over, we may see 20, 25 million people losing their jobs. Hopefully they'll be able to get some sort of benefits from the government. It's going to cushion the blow. It's not going to be enough, though.
Kate Tulenko, on Tuesday, the White House coronavirus team, they gave us a pretty comprehensive view of what is taking place right now, complete with multimedia slides, which we saw. And we saw that outside of areas like New York and New Orleans and Washington State, the rates of infection were relatively low. And they also told us that New York could be taking the turn right now. President Trump has advised that those guidelines that he announced a couple of weeks ago, that they be continued until the end of April. But do you see these measures in place for a lot longer?
I think we'll have to wait and see what's the rate of new infections in New York and other cities at the end of April. If they're slowing down dramatically, and if we're able to test everyone who wants to be tested, then it might be possible that county by county, the economy could be opened back up. I think there would need to be very strict criteria. We see Germany giving people certificates of having had COVID, and presumably they're now immune. We could also potentially see governments give businesses certificates of being COVID-free, for example, in that they do universal COVID testing of their employees, they do daily temperature checks and symptom checks, they might have universal mask wearing at the work site, as well as a hand sanitizer available. So I think there are ways to open up the economy, but we'll have to reassess on April 30th.
So, Kate, if governments are considering things like certificates to declare a certain country or a certain region COVID-free, I guess those regions and countries would have to meet certain benchmarks.
Mm-hmm. Absolutely. So, and for to be COVID-free, absolutely COVID-free, you would want to see no new cases for at least 3 or 4 weeks. And WHO actually has some strict guidelines around that. And I think we might not see that for quite a number of months. When you look at China, they're having all these little fires pop up of very small outbreaks. And I think even if we're able to get over the main surge in 2 or 3 months, I think we can expect for the 4 or 5 months after that, putting out these little fires.
Joseph Williams, the United States Vice President, Mike Pence, he says the closest comparison we could have in the United States is with Italy, which, as we all are aware, is really struggling. The casualty rates in Italy were enormously high. But what does that tell us about the American response?
It tells us that the U.S. response was essentially flat-footed. We had months to prepare. We were caught unawares. For whatever reason, the administration did not take this seriously and ramp up when they had the opportunity. Italy is not a flattering comparison. I'm not really sure if Vice President Pence was trying to go there and make sure that we were looking good, because Italy's numbers have been devastating. It has been tragic. And there is a lot of frustration and a lot of questions being asked about whether or not the White House took this seriously enough and got enough preparations going and geared up the nation and states and responses enough to get this number down to where it was even more manageable than they say it is right now. And I want to bring up one other point really quickly. In my view, in what I've been hearing and reading, the the leading COVID indicators, if you will, are New York, Seattle, California, the coasts. We don't yet have a very significant reading about what's happening in the interior of the country in some major cities there and in some poorer areas. New Orleans is a very significant hotspot, but New Orleans is not really getting a lot of attention, and we don't know basically we don't know what we don't know. We don't know how widespread the virus is because we still don't have enough testing kits to get ahead of the curve.
Kate, what are your thoughts on that? Could we be possibly undercounting because of the lack of information from Middle America, the interior?
Absolutely. We're not testing enough. Still 1 month into this, there's not enough testing kits to test even healthcare workers, much less everyone who's symptomatic or everyone who wants to be tested. So that needs to be ramped up exponentially, and hopefully that the Defense Production Act will be put in place to ramp up production of the testing kits.
Anthony Chen, we were talking a moment ago about the jobs outlook in the United States, but what do you think could happen in the next, let's say, 4 to 6 weeks if we see the numbers go down? Could you see certain sectors of the economy reopening?
I think that right now it's probably too early to really expect that things are going to reopen. Remember, the WHO organization says that on average, the process takes about 90 days, and that assumes that a country is doing the right thing. And I can't say the United States from day one was doing that. So that would suggest that by the end of April, if we become very aggressive, we may start to see the number of new infections starting to go down. And then roughly another 40 days later, again, assuming a country is continuing to do the right thing, you probably see the number of new infections almost taper down to nothing. Here in the United States, because we may not be as aggressive as other countries, maybe 60 days. So maybe by the end of June, we probably see some real improvement. So I would say that in terms of the economy turning around, it probably will be too early in the third quarter, because the third quarter may be a transition quarter. But certainly by the fourth calendar quarter, if the schedule persists as I've outlined it, using that WHO data, we may see a recovery in the in real GDP and the overall economy. But I really have a hard time believing that we'll see a recovery in economic growth before then.
Einar Tangen, China appears to be showing signs of recovery. We got some data on factory activity, and it shows that factory activity expanded in the month of March. What does that tell us about China's ability to recover?
Well, I mean, we were going to have to wait and see. This is not a done deal yet. There are very good numbers so far, but you're starting to look at industries which have been devastated. One of the reasons that China's central government, Beijing, has rolled out all of these incentives, especially on the business side. They're very concerned about small, medium-sized enterprises, the auto industry, all of the restaurants, everybody who was hit very, very hard by these lockdown. But I think China realizes that it was better to take this short, sharp shock of this 2 months of isolation so that they could start getting their economics back into gear. I agree with my colleague who said that if you delay this, if you don't do the right thing, you're not going to have any kind of economic recovery because you're going to continue to have reinfections. I don't think there's any place that has shown that you can do a patchwork type of reintegration of your economy while the virus is going around. Because quite frankly, you could be virus-free today and then tomorrow you could be infected by those coming from outside. So it's just not clear that the U.S. has taken this seriously, even as it's announced all of these cuts. You see patchwork. 10 states are still not taking it seriously. And unfortunately, until the entire nation does so for a 2-month period, this is not going to be over, and there's not going to be a way of calculating the economic damage.
Einar Tangen, I guess the other challenge for China is that factory activity may be expanding in China, but foreign demand is still going to be very slack, isn't it?
Yes, it is. And right now, a lot of small, medium-sized enterprises are looking at how they can switch from exporting things to markets that are now basically dead to trying to satisfy the internal demands of the Chinese from goods that will not be shipped to China. So this is a temporary case where they're trying to figure out how to do business, any kind of business. And that's all that's going to be open to them, because the formula I was just saying, until the U.S. takes this seriously, this is true for the rest of the world, and China is affected by it. So for now, China has to look internally, both at its large consumer markets and its production base, and try to ride out this storm until the rest of the world figures out. Now remember, we keep talking about the U.S. and China, but the rest of the world is going to suffer much more. So you start extrapolating 200,000 deaths for 5% of the population with the best access to health care, and then you put that around the world. This is going to be a very, very difficult time.
Anthony, the chief of the International Monetary Fund, the IMF, KRISTALINA GEORGIEVA, she says the global economy has entered a recession. Let's listen to some of what she had to say.
We have reassessed the prospects for growth for 2020 and 2021. It is now clear that we have entered a recession as bad or worse than in 2009. We do project recovery in 2021. In fact, there may be a sizable rebound, but only if we succeed with containing the virus everywhere and prevent liquidity problems from becoming a solvency issue.
Anthony, very quickly, I'm sorry, we are squeezed for time here. In about 30 seconds, do you agree recovery by 2021?
I think there's a possibility if we contain the virus. It's not just the U.S. You just saw the consumer confidence numbers in Europe taking a big drop, a big plunge. In fact, the monthly drop was the biggest one that we've seen, certainly since the numbers have been put together. So again, it's spreading out. And then, of course, developing economies. So the rule of thumb for the IMF is that when you have 2.5% growth globally or less, that's defined as a global recession.
Okay, thank you. And thanks to everyone for being on the show this evening. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.